Everybody else, please mute yourself.
Meeting call to order.
Thank you, President. I request President Rotarian BPTH Ritika Gupta to confirm the minutes of the previous meeting.
Can someone please mute? Yeah. The minutes of the previous meeting were circulated on the group and no queries have been raised for the same. Therefore, the minutes of the previous meeting are confirmed.
I will just mute Mr. Bhargav, who is more interested to listen the commentary. Just wait a minute, please.
Also, if you could make me co-host, please.
Yeah, I will do that.
Yeah.
Thank you. And today we have a very important topic, which is physiotherapy for healthy organs. And we have a very eminent physiotherapist with us, Dr. Rashi Doshi. She is the consultant physiotherapist from Mumbai. And I request Rotarian Rajesh Gurani ji to please introduce our guest for today. Please unmute and introduce. Please unmute.
Yes. Very good evening to all of you. Today we have an eminent physiotherapist with us, Dr. Rashi Doshi. So I have the pleasant duty to perform to introduce her to all of you. She has done her bachelor's in physiotherapy. She has done her completed a master's in occupational therapy, and she is a member of Indian Association of Physiotherapists. She is a consultant physiotherapist at Praxis Healthcare and Polyclinic, Parle, West, Mumbai. She is an experienced physiotherapist specializing in pain management, injury rehabilitation, and patient-centered care. She has proven expertise in developing individualized treatment plans and therapeutic interventions. She previously worked as a consultant at Criticare Multispeciality Hospital in Mumbai, Police Hospital Nagpada in Mumbai, Dr. Deepak Kachalia's clinic in Mumbai, Dr. Sangeeta Chadda's clinic in Lokhandwala, Mumbai, Checkpoint Health and Diagnostic Treatment plans for functionality, restoration, and pain management. She conducts clinical assessments for acute and chronic conditions. She provides post-surgical rehabilitation and home care therapy. She is providing patient and family education on injury prevention compliance. She has participated in ergonomic health seminar, Goldman advertising in 2020.
Mr. Rotarian Rajesh, your network is
Joint
weak.
management with Dr. Deepak Kacharia in 2016. She has had community camps at Blind Association School and Police Hospital in 2017. Her core competencies are pain management, post-surgical rehabilitation, clinical assessment, therapeutic exercise, patient education, home care therapy. This is only to name a few. She is an accomplished physiotherapist. I hand over to her for taking it further. Thank you, madam.
Good
Over
evening.
to you, Dr. Doshi.
Yes. Good evening, everybody. It's a pleasure to see all of you and share whatever valuable knowledge I have based on my topic. I will just share the screen slide. Am I visible? Is this visible?
Yes, please. Go ahead.
Okay. Just a second. Okay. I am Dr. Rashi Doshi, a practicing physiotherapist since past 10 years now. I am here to talk about how important physiotherapy is for our organs. First, let's understand what actually physiotherapy is all about. Physiotherapy is nothing but a healthcare profession which assesses people affected by injury, illness, disability through various modalities, manual therapy, exercises, patient education, and I'll be happy to share that of lately, the awareness of physiotherapy is not only restricted to our joints and bones, but also to our organs as well. There are 5 ways through which physiotherapy improves in our everyday life and activity. It is no longer associated only with injury, but is also essential to improve your quality of life. It works on balance and stability, helps in reduction of pain, improves mobility, post-operative rehabilitation, as well as to improve our well-being and give us a better quality of life. Physiotherapy is most commonly associated with musculoskeletal issues like your joint pain, any injury recovery, but is also a significant role now in maintaining the overall health of internal organs. This is often overlooked but is a very essential part of our holistic healthcare. People usually have a misconception that physiotherapy is restricted only to joints and injuries. But what we don't know is that physiotherapy supports the function of our healthy organs by improving your overall blood circulation, improving your lung and heart health, by enhancing your overall physical activity, which is very crucial in preventing chronic conditions as well as maintaining your overall well being. When we perform exercises, we aren't just making our muscles happy, but our organs are doing a very happy dance itself. Let's see how physiotherapy helps in maintaining these organs in a healthy manner. I have cut it down into various systems. The first and the very important is our cardiovascular system, which consists of our heart and blood vessels. The part of physiotherapy which takes care of our heart and blood vessels are our cardiopulmonary physiotherapy. It improves cardiovascular efficiency, especially in people recovering from heart surgery, heart failure, or any kind of pulmonary conditions. We all must have seen that anybody who goes through a bypass or any heart surgery, they are often referred to a therapist to take care of their cardio rehabilitation purpose. Now, how does it help? It improves our heart and lung capacity through various breathing techniques and aerobic exercises. It helps in improving our circulation and oxygenation of organs. It most important, it prevents a very serious complication like your deep vein thrombosis through early movement, which is called as early mobilization. The examples of what we do in cardiopulmonary physiotherapy is treadmill walking under supervision, uh, extensive cardiopulmonary rehabilitation, which consists of your breathing exercises, your resistance training, which works on your endurance and to get back to your feet. Next comes our respiratory system, which consists of lung. This is one of the most extensive department of physiotherapy where you'll see a lot of physiotherapists working in the ICU, and you realize the importance of it. It is known as a pulmonary physiotherapy, which is vital for patients with asthma, cardiopulmonary disorder, pneumonia, the cases that we are seeing on and off, especially post COVID lung damage. But it also helps in maintaining your healthy lung function. How does lung physiotherapy help is it helps in clearing excess mucus from your lungs. It increases your lung expansion. It improves your oxygen capacity. How we do this physiotherapy is it comes under chest physiotherapy. There are various techniques which we have mastered, which helps in removing excess of cough, which is blocked in the lungs. Then there is something known as incentive spirometry, postural drainage, and again, early mobilization. Any part of physiotherapy is incomplete without movement. Next is your neurological system, which consists of brain and nerves. I'm sure somewhere we all have experienced or seen our relatives, family, friends going through some of these issues, because this is becoming very common day by day, and hence the awareness of physiotherapy is increasing because of it. The neurophysiotherapy, which consists of the brain and your nervous system, especially in brain stroke, Parkinson's, or various other head injury, spinal injury, any accidental cases that we see, what it does is that in general, your balance and your coordination is improved through this form of physiotherapy. How it helps is it stimulates your neuroplasticity, it works on your overall motor control and coordination, and most importantly, it supports your blood flow to the brain. The various types of therapy that we do in neurological system is work on your balance and gait training, something which is very important in a geriatric care. That is mainly a lot of senior citizens we see after a certain age, they go through a lot of balance issue, so balance and gait training comes under this form of physiotherapy. There are dual tasking exercises which works on your movement as well as on your balance and coordination, your reflex training and your proprioceptive work as well. Next comes our most important organs, which constitutes of the digestive system, which is your stomach, liver, and intestines. Though less direct, a form of physiotherapy which can positively impact your digestion is through movement, breathing exercises, and posture correction. How it helps is your movement, any kind of movement or exercises that you do, it enhances your peristalsis. And peristalsis is nothing but your intestinal motion. Then comes, most importantly, your diaphragmatic breathing, which supports your abdominal organ function. Then is your core strength training, along with which it helps your abdominal pressure to get control and work on your core strength. Breathing exercise, a lot of times we see patients coming and telling us that, oh, this breathing exercise is very simple. It's something that we do on a very daily basis. But what they don't understand is the technique with which you do it. When we make a patient do a simple form of breathing exercise, we want the abdomen to increase, the abdomen to bloat, and then breathe out in a certain particular way. It's only then that your abdominal organs and the functions are improved. Like I already mentioned, that the form of physiotherapy exercise that we do for our digestive systems are your core activation exercises, your postural training, and your basic gentle yoga stretches, which also helps in our organs. Then comes our pelvic organs, something which we see very often in women's healthcare. The organs that are included in this are your bladder, your uterus, your prostate, and your rectum. Kegel exercises are something which on and off a lot of doctors are prescribing, and even people are getting aware when they know that there is some kind of urinary incontinence coming into picture. And you'll be surprised to know that it's not only restricted to women, but even a lot of male patients, especially the geriatric male patients, who are also referred for pelvic organ physiotherapy to work and strengthen your urinary muscles. So, pelvic floor physiotherapy helps with urinary and your fecal incontinence, the sexual function, and support for pelvic organs. How they help is they work in strengthening your pelvic muscles, relief in your pelvic pain, and improving your bladder and bowel control, something which is again seen very often in geriatric care. The type of exercises that we do for this is Kegel exercises. There is something known as biofeedback and electrical stimulation, in a way that we use a lot of various accessories for your urinary muscles to come under control and start strengthening. Like you must have seen that for your legs and hands, very basic, we use dumbbells, we use weights. Similar way, we have a very specific accessories which is used in the form of Kegel exercises to work on your pelvic muscle strength. Next is immune and lymphatic system. This is something that a lot of people are not very aware of, but in cases of post-operative cases or even post-cancer rehab, your lymphatic drainage is a very important system that needs work, and it helps in preventing fluid buildup and boosts your overall immunotherapy. How physiotherapy helps in this is through movements and exercises. It reduces the edema and swelling. It enhances your detoxification, trying to remove all the impure blood and oxygen which is stored in the body. It helps in promoting your circulation of overall immune cells. Like I already explained, the types of therapy that we do under this form of rehabilitation is your manual lymphatic drainage, the compression therapy, and a new form of physiotherapy which is very upcoming is hydrotherapy. So all of these forms of exercises are something which helps and enhances our immune and lymphatic system as well. Just to give a small summary, there are various forms of physiotherapy that I have mentioned in the type of physiotherapy, and as we can see, our most important organs and how they benefit from the type of physiotherapy that we provide. Your heart and lungs, they come under cardiopulmonary access, the physiotherapy. They help in better oxygenation, improves your stamina and your endurance. Then comes brain and nerves, which forms the neurophysiotherapy. The benefit of it is working on your motor function, your balance, your cognition. Next organs that we work on are stomach and intestines. The physiotherapy care that we give under them is postural and strong core therapy, which improves your digestion, reduces acid reflux. Next is the pelvic organs. The type of physiotherapy that works for this is a pelvic floor therapist specialist. The benefit is to work on your urinary and fecal incontinence to improve the overall sexual health. Last and not the least are the lymphatic system. The type of physiotherapists that works on this are specialized and they focus on lymphatic drainage. It helps in swelling your reduction of your swelling and working on your immunity. I would like to conclude by saying that give the gift of life, share your spare. Don't take your organs to heaven. In fact, give them to someone in need. Make yourself a symbol of hope, donate organs, and save a life. Thank you very much.
Thank you very much, Dr. Doshi, for.
Thank you, Dr. Doshi, for such a beautiful presentation. Over to you, Charter President, Rotarian Goel.
Thank you very much, Dr. Doshi, for giving your views on physiotherapy, how it can help to keep our healthy organs. Before I will open the forum to ask the question, my first question to you is, what is the difference between physiotherapy and yoga? Because the yoga people feel that the yoga is the best for keeping someone healthy, including organs. Do you think the physiotherapy can also work, or is it better, or is it, what are the differences? So we would like to enlighten us between the physiotherapy and yoga.
So you'll be surprised to know that in our physiotherapy curriculum, we have yoga as a subject. So we know the importance and benefits of yoga, but to say that to compare between a yoga therapist and physiotherapist.
Just hold on, please. Just hold on. Just hold on. I will mute someone.
So I've put the Samsung account on hold.
Samsung
account.
Dr. Verma, please keep yourself on hold, please. Mute, please.
I'll do it.
आदित्य आई एक मैसेज आला है.
Yes, Dr. Doshi, please go ahead.
Yes. So like I mentioned that we have yoga as a very important subject in our physiotherapy curriculum because we understand the benefits of yoga. Now, to compare that yoga is the only form of therapy which is good for organs, what yoga does is that yoga works in your overall health by improving your mobility. It's a very generalized concept. Yoga therapist doesn't work on any particular organ or any form of injury. We physiotherapists as a whole, you must have seen that we have extensive specialists So when we work, we target on a specific organ, a specific injury to look after, as well as a holistic care. So yoga definitely is a very important form of exercise that we incorporate even in our form of therapy. But only doing yoga is not the key to work on an overall basis. But definitely, I always tell my patients, especially after 30 or 40 years of age, that yoga helps you to keep going. It works on your overall mobility, your overall holistic care. But when you know that there is something going wrong in the body, you have to go to a physiotherapist to work on that injury, to work on that organ, and then you go back to your yoga therapist.
Okay, thank you very much, Dr. Doshi. Now, whosoever wants to ask question, please unmute so that I will, yes, Rotarian Advocate Ramesh Sharma, please.
Yeah, in continuation with the question of Mr. Goyal, I would like to know the difference between exercise and physiotherapy.
There's no difference. See, exercise makes up physiotherapy, is what I can say. Right? Physiotherapists are nothing without exercise. When you go to a physician or any doctor, and if you ask them what is the difference between medicine and physician, they will be that is what makes them up. So the same way, exercises are the most important part of physiotherapy. You must have seen that a lot of times we have a lot of electrical modalities and electrical things that we use to work in conjunction with pain. But we have those patients coming back to us with the same problem because we are not treating the root cause. So exercises makes us physiotherapists. We are nothing without exercises.
Okay.
Thank you very much. Yeah, anyone else, please unmute. Yes, Rotarian Ritika Gupta, please.
Hello, Dr. Doshi. It was a very enlightening presentation that you gave, and you touched upon a lot of topics where you talked about lymphatic drainage as well. So I just have a question for you. So there are a lot of conditions related to the face, wherein there is Bell's palsy, there's asymmetry, and all of those
Yeah.
for which you do give, I think, some kind of
Electrical
traction or
stimulation.
all
Electrical stimulation, we
right,
call.
right. So, if that is done for as the initial step of curing, how much do you think exercises help in that? Like, do you use solely your electromagnetic radiation as a way of treatment, or you resort to exercises as well as a way of treatment? And how often do you recommend practicing those exercises?
So since you mentioned one condition, I'm just going to give you an example based on that. With Bell's palsy, what we know is it's a compression of a nerve which affects your facial muscles. So what we do using the electrical magnetic stimulation is that we are trying to awaken those muscles. I'm not able to
Right.
raise my eyebrow. Okay. I'm trying to wake those muscles up with a stimulation. They are getting awakened, but until and unless I don't keep practicing doing it, with my finger, it's not going to help. So whatever exercises we do, it's always in conjunction with the electric magnetic stimulation that we do. You must have seen that these days a lot of athletes, a lot of celebrities are also working on electromagnetic stimulation as a form of exercise. But they put those machines and they are exercising along with it, because that's when you are awakening your muscles and telling your muscles that this is your role, but you have to keep going on it. So
So
even
are you just touching base upon those vibration machines, the on which you stand and you go for like about 10 minutes every day morning on the
yeah,
plate?
I'm talking on various conditions. Now, if you come to me with a back pain, I might not need those stimulation. With just my knowledge of manual therapy and exercises, I can relieve your back pain.
Okay, okay, okay.
So exercise, what we do is first and the most foremost, exercises are the first line of treatment that we go ahead. In certain cases where we know that the pain is very chronic, they need something as a form of pain management. We use those modalities. In nerve condition, for example, your Bell's palsy or any athlete who has an event and needs to get going pretty quickly, we take help of the electromagnetic therapy and other modalities that we use. But it's never only the modality, it's always with the exercises that we go ahead.
Okay.
Okay.
And another thing, if I
Sure.
may just ask, how much do you promote face exercises, which are a very big part and are growing every day? So, how much do you support face exercises as a way of working for these particular issues?
A lot of times, a lot of times. In
Okay.
fact, we tell the patient that as a form of biofeedback, you have to stand in front of the mirror or sit in front of mirror so that you realize what type of movement are you doing. What are we? In general, we use our facial muscles so many times that until and unless it goes in a state of paralysis, we don't even realize that, oh my God, I have been using these muscles for so long. So even for
Right.
those, and even to tone your jaw muscles, to do a lot of facial movements, and to even get going, we use a lot of facial exercises as and when prescribed and needed. And especially in nerve paralytic cases, I tell the patients to do those exercises at home at least 3 to 4 times, which constitutes of 10 to 15 counts. So almost 50 to 100 times a day. Only then you know that it's going to help you further.
All right. Thank you very much. Thank you.
Okay, thank you very much. Now, Rotarian Pratul Agrawal, please.
Thank you, sir. Yes, Dr. Doshi, welcome to the show. And you have been very graceful throughout and cool and comprehensive about your subject. My query is, do you have something for the psychological health in the physiotherapy, or it is only limited to physical health?
So, psychological health comes along with it. When you have a patient constantly complaining of pain, you know that they need something to calm down their mind and they want someone to listen to you as well. So, like I already mentioned to Rotarian Ritika ma'am, that when we work on these electrical machines, a lot of times when we see that the patient is very anxious and needs some kind of a feedback that is going to help them and calm them down, we use these machines as a placebo therapy. They'll feel that, okay, yes, I have been doing something and it's going to help me. So the psychological well-being of a patient is the utmost patient care that we have always kept in mind. Some of them might not even need it because they are aware of what they are dealing with, but a lot of times we do have a lot of anxious patients, and the first thing that we do is to calm them down by educating them well, sometimes giving in what they want to listen from us, so that we know that okay, now they are calmer and they will have the faith in the therapy that we are going to give to them. And a lot of times we use some of the modalities as well as a placebo effect, and it does wonders.
Okay, thank you very
Thank
much.
you. And
Thank.
impatience is a big problem these days. So how do
Sorry.
you deal with the patients who are very impatient and want quick results?
Yeah, impatient is the key. These days, I think that's the first thing that we look into a patient, that we want to get better in 2 days, but with proper patient education. The first consultation session only that I personally give, my 20 to 30 minutes goes in only explaining the patient in the best way possible. When a patient comes to you, you understand what type of words they want to listen to. It comes with practice. So I think in 10 years of my practice, I am trying to master that act of getting them to calm down.
Thank you.
Okay, thank you very much. Rotarian Rajesh Gurani, please.
Yes, madam. Dr. Rashi, thank you very much for this great presentation, making it very small and simple. Yet, so many questions have arisen.
Yeah.
Maybe yes, your department plays a lot of role in keeping the organ safe so that it can be passed on to the persons who need it.
Yes.
I just wanted to understand, as a cardio, I may understand, how does pulmonary physiotherapy, it takes place?
Post COVID, when I was interning, we used to get references from the doctors to the patients related only to the ICU care. But post COVID, once everybody understood the importance of lung, the importance of right form of breathing, the whole faculty of the pulmonary physiotherapy just boomed, because people started understanding that there is a certain way to train your lungs. When I want to train my elbow, it's very simple. I'm doing this with weights and I can see that it's getting toned and worked. But something like organs, you don't understand how it's going to help until you become one of it, right? So pulmonary physiotherapy has become really big, and a lot of awareness has come into picture post COVID, that lung care, not only in the form of breathing, but a lot of different accessories that we use, like your spirometry. You must have seen we have 3 balls. You just have to breathe in, out. You blow a candle. Simple exercises like those, they have become really important. And only when you do those exercises, you find a difference in the way of your breathing. So pulmonary physiotherapy is something which has become very important these days. And anybody who's undergone any form of surgery, anything, the first thing they are referred to is pulmonary physiotherapist.
Okay.
Thank
That's
you very
great,
much.
sir. Thank you.
Thank you. Yes. Any other question from any of the member?
Yeah. One more.
Advocate Sharma after Dr. Monis, because he's there. Okay. Rotarian Dr. Monis, please ask your question.
Yeah. Dr. Rashi, good evening.
Rotarian Monis, your voice is not clear. Rotarian Monis, we can't hear you. We can't hear you. You just be in the proper network. Rotarian Monis, yes. Rotarian Advocate Ramesh Sharma, you please ask your question till the.
And what is your experience?
I don't think. Yeah.
Dr. Monis, can you put your video off and then try, because your network is weak.
Your network is weak, Dr. Monis.
Oh, can you hear me now?
Yes.
This is better.
Better?
Yeah.
Yes.
Okay. Rashi, the question to you was, I mean, in your experience, have you treated patients with post-organ transplant? And if yes, what measures did you implement in that patient?
I couldn't hear you actually.
Post-organ transplant. Your question is post-organ transplant, whether she has treated or not, correct?
Have you?
Sorry, Dr. Monis.
Yes.
Please write and send on the. Yes, Dr. Monis. Can you ask now? No.
Yes, my question was.
No, your voice is cracking. Please be in the network, proper network, please. Or close all other devices, because.
Has Rashi been exposed?
No, we can't hear you. Sorry. Rotarian Advocate Sharma, please ask your question.
I just want to know how physiotherapy may be helpful in controlling memory loss in old age.
So there is a when we work with balance and coordination, we incorporate a lot of memory games. You must have seen small kids playing a lot of memory games, because we are trying to develop their mind and their brain to get in the habit of memorizing and improving the overall health of your mind. Those same exercises we use at a older age as well. A very simple memory game that we all have played in childhood. We place 4 things, 4 objects. We close them. We make them remember that, okay, number 1 was probably an apple, 2 was a book. We shut it, and then we ask them that what was placed on number 2. So how we work on this is repetition. The more and more you do these forms of repetitive exercises, you are trying to train your brain and your mind that, okay, this is how we have to. It's basically retraining.
Retraining.
Yes, it's all about retraining.
So one has to become a child.
Yeah. In fact, when we work with older people post 60, it's exactly like how you deal with a child.
Okay.
Thank you.
Thank you very much. Now, yes. I think Rotarian Professor Dr. Sudhi Sharan is laughing on this. So you have an ask. But before that, yes, Dr.
Can I
Monis,
ask something?
I think Dr. Monis has sent a message because he says that rains are there in Bangalore. In Mumbai also we have the rains, but network is working here. So Dr.
So
Doshi,
I will take the
question.
chance. I will try to talk.
One moment, Professor Sharan, keep patience, please. Rotarian Dr. Moniz has asked the question. His question is, how has your experience been in treating post-transplant patients? If yes, what modalities were used?
So to be honest, in my experience of 10 years, I've come across only one patient who was a post-heart transplant patient. There were no modalities used in his case because it was not needed, but there was an extensive set of physiotherapy exercises that went with him. It was a long period of recovery, and what we really focused was on the form of cardio rehabilitation, which involves three different stages. First starts with all your basic bed exercises and trying to get your lung to start breathing and getting the right amount of oxygenation, trying to, like I said, retrain your muscles that, okay, you have to now start slowly getting used to doing your basic movements. That lasted for almost 3 to 4 weeks. Then came the second stage where we make the patient walk. The form of movement also comes with your breathing capacity. So you're not only working on your leg and hand muscles, we also focused a lot on the lungs, trying to get the patient to breathe by itself. The minute you start moving, start walking, you are improving your circulation as its own. So the whole therapy that went in that one particular patient that I treated was a post-heart transplant. It went for good 8 to 10 weeks.
Okay, thank you very much, Dr. Doshi. I'm sure, yes, Dr. Moniz has sent a message, appreciated. Okay, now Professor Rotarian Professor Dr. Sudhisan, I think you are also on the road because you are moving, or it's not.
Yes,
Today
I'm
everybody is
driving.
on the road. Yes, please, Professor Saran, you ask the question, please.
Okay. Thank you, Dr. Doshi, for a very clear presentation. I have one specific question for you. As we advance in age, what best physiotherapeutic exercises are there which can improve our neuroplasticity?
Yes. So, in my care right now, I have at least 10 patients who don't have any kind of aches or pains, no injury, no neuro-related issue, but the only reason why they want to continue with physiotherapy at least once or twice a week is for their overall fitness. Because as they near the age of 70, they are aware that I want to be fit, I want my mind, my brain, my all my organs and system to work in sync. So when we see patients who just want us to work on their overall fitness level, we incorporate everything together. There is a little bit of strength training that comes into picture. There is a little bit of cardio exercises in the form of aerobic exercises. There are breathing exercises which focuses on your respiratory system, and as well the most important is balance and coordination. So when we work as a sync, when we work on all those systems together, that's when they know and are aware that their overall health is on a better road of recovery.
Okay.
Thank you very much.
Thank you very much, Professor Saran. Yes, anyone else wants to ask the question? Please ask the question. Rotarian Deepan Shah, are you there, or you are also driving? I think he's also driving. Rotarian Hemlataji, you have any question to ask? Rotarian, I think Rotarian Ramnath Pradeep ji is having a question. Yes, please.
Dr. Rashi, I really appreciate your presentation. I am one of the beneficiary of myself and my wife both are beneficiary of continuous physiotherapy. I go to one of the physiotherapy college in Mumbai.
Right.
And I am really a beneficiary of this. I go for 6 days, all 6 days to the college, and I take all so whatever the questions have been raised by my learned friends,
Yeah,
I continue to enjoy that all the facility in that college.
absolutely.
There is so yeah, after attending all this, my wife was suggested by doctor, to go for the spine surgery. But after attending that college, I took her to the college, and from
Right.
there, I took her on the wheelchair, and she came walking
I'm so
perfectly.
glad. I'm so happy to hear
So
that.
this is the effect of
That's
physiotherapy.
the power of physiotherapy, is all we
Yes,
say.
and I myself has benefited because I reduced some of the medicines which earlier doctor were giving. My
Right.
blood pressure has come down. My blood sugar has come down because of the
Absolutely.
physiotherapy.
Absolutely.
So physiotherapy, I'll suggest to all my friends who are above 70 or above 60, they should continue to avail this facility wherever it is available. But it is rightly said, you may not be able to go on every day, because I go every day because it is very near to my house.
Correct. Even when you try to do it at least once or twice a week for a
Yes,
regular period
yes,
of time, you will definitely see the benefits of it.
yes. So I have really got the benefit. Myself and my wife both have got the benefit.
So glad, so
So
happy to hear that.
thank you for physiotherapy.
Thank you very much, Rotarian Ramnath Pradeep. Now, my question to you is, a healthy person, according to you, if, I am not talking of an old person like us, but young persons who are also our members, do you think that at about 40 years of age, a person should go to a physiotherapist and do the work for their healthy organs? I'm talking of healthy organs because the latest reports says that the 20% of IT professionals in Bangalore are suffering from organs failure. So do you think that a person who is having full of stress work, like working in bank or working in a IT company, etc., they should go and visit a physiotherapist and start doing physiotherapy instead of doing only yoga?
Absolutely, sir. I have my youngest patient is a 16-year-old as well. You know, when we cater to younger, that age population, you have people coming in only when they have aches and pains and everything. But of lately, people have got scared that as young as 30-year-olds are dying of, heart attack, cardiac arrest. That has really made people aware that only doing yoga or only going to gym for extensive training is not going to help. So when we have such younger people coming as well, there is a different type of exercise that we cater to them. The intensity of exercises that we do with them is different from the exercises that we do for the older population. But most definitely, yes. And you'll be surprised that people are actually, since past 1 year, when they have seen that so many young people are dying of cardiac arrest, they are actually getting aware and they want to come and guide themselves under a trained physiotherapist to work on their overall lifestyle and not just go to the gym and work on muscles. So that definitely helps a lot. And I have
But
personally trained a lot of people like that.
but do you think for this every day or every once or twice a week they have to visit you, or once they have done a say 1 week's or 1 month course with you, then they can do it at home of
So, sir,
themselves?
what I usually do is when our patient comes to me, somewhere we understand that the patient is disciplined or not. When I have a very disciplined patient who understands that, okay, it is the need of my hour, we teach them exercises and we do a once a week follow up, which slowly then progresses to 10 days follow up, where we change the whole exercise plan. But we also have people who are quite lazy, and we know that no matter how much we force them to do the exercises at home, they don't do it. And we come to know, if you're coming with some kind of discomfort, or in general, if I see that there is no improvement in your strength even after 10 days of exercise, I know that the person is not exercising at home. So for those particular patients, we advise them to come starting twice a week, and slowly, once they get to the groove of those exercises, they will come and tell you that, okay, now I have started exercising at home. Is when we shift them to once a week, slowly catering to 10 days, 15 days, and regular follow ups. Follow ups are very important. When you do certain type of exercise for longer duration, it comes to a rate of stagnancy. Then your body and your organs, they don't show the kind of effect you want. That's why the one thing that we really focus on is follow up, that every time you come to me for a follow up, there is a lot of new things that I'm going to teach you.
Okay. Now, One more question, because I am waiting for someone else to ask, but I am asking the question. Difference between physiotherapy and the gym, because nowadays gym has become a cult. Everybody is going to gym in the morning, doing the gymming, and they feel that the gym is something which changes there's a game changer. But what is happening, the gym has become a commercialized thing, as people know, many of them, I'm not saying everyone. So do you think a person should go to gym or to a physiotherapist for their own benefit, and especially the benefits for the organs? Because the gym trainer is not a person who is trained for 3 or 4 years, who has not taken a formal training. So I don't think that he knows what is the condition of your inside body. So what are your views about that?
So absolutely. So this is, like a day-to-day discussion that has come now, where people are confused whether should we do physiotherapy or should we go to gym. What happens is a lot of times gym trainers, they push a person to an extent that your body is not able to tolerate that level of high intensity exercises. And that's when we see, as common as cardiac failure happening over a treadmill, when a person is on a treadmill for like good 1.5 hour, or say any kind of other bone related, muscle related injury, or any kind of organ related issues. So one thing that I have a lot of people, I myself go to gym as well. So what I usually tell them is that do it as much as you can, do it for your overall benefit, because there are extensive exercises, extensive machinery that's there in the gym. You can do a lot of yoga as well when you go to gym. A lot of gyms are now offering basic kind of facilities like your yoga, your strength training and everything. The one thing that I really tell them to focus on is that do as much as your body tells you. Respect your body and listen to your body. The minute you feel that, okay, I am not able to do this, you stop there and there. There is no reason for you to push your body. If out of 10 sets of exercise, you are able to do only 8, and you are not able to push yourself to do the last 2 sets, you drop it there and there. The most important thing is listening to your body and respecting the pain and the signs that your body is giving you.
Respect your body, listen to your body is the mool mantra given by Dr. Doshi today. I think there is no other question, so hand over to you, whosoever is there available. Yes,
Yeah.
Yes, please go ahead. Rotarian Secretary, yes, please.
Yeah. Should we go for the vote of thanks if nobody else has the question?
Yeah, I think so.
Yes.
Okay, then I request Rotarian Hemlata Bandari ji to please give the vote of thanks for a wonderful session today.
Dr. Rashi Doshi, thank you for your wonderful presentation about the physiotherapy for healthy organs. And we are grateful to you for sharing your experience with us, for guiding the precious organs within stay strong and healthy. It's apt to say that your health is deep well, not just your stride. Physio helps organs thrive inside to lead a quality life. And finally, expressing the view to make yourself a symbol of hope, donate organs, and save a life. I, Rotarian Hemlata Bandari, on behalf of the President and the Rotary Club of Organ Donation International, would like to express my sincere gratitude to all of you for attending and watching this informative and inspiring meeting live. Thank you once again.
Thank you very much. Meeting is thereby adjourned.
Thank you.